Hi, welcome back to part two of sequestration and audits. We ended the last one with a question, and we wanted to make sure that we had plenty of time to let you guys in on the information that Sandy Decker with Association for Home Health and Hospice of North Carolina and South Carolina and Dee Cornetti can lend to us. So thanks for coming back for part two. And here's the question, ladies. What should home health agencies do right now to get prepared for what's coming next?
Well, honestly, where we ended it the last time, Sandy and I were in agreement that, we have to go back to the ABCs of it all. We have to go back and look. We've basically been in this bubble, this no pun intended, this period of time with waivers and limitations where we've had expansion of activities or freedoms such as telehealth and the completion of the face-to-face and what waivers can cover. And I think people have really been struggling to make sure infection control is tight, to make sure PPE is available, to make sure everybody's up to snuff. And we may have gotten a little bit complacent in stepping away from those Medicare benefit policy manual requirements that are the essentials, the ABCs of eligibility and payment for services under the home health benefit. So I can see, honestly, where targeted probe and educate is going to kind of rear its head again. I can see, as Sandy was saying about, maybe the RAC auditors, coming back in, being in the RCD. Sometimes we don't want to shine the light on ourselves, but ultimately, I think we have to lean into, looking at our processes and our activities, even through the pandemic and into PDGM and these continued extensions of the pandemic. We have to look and make sure we're still hitting those essential elements. Wouldn't you agree, Sandy?
Oh, absolutely, Dee. Keep thinking the worst of it's behind us. The worst of it is behind us. And then the head of the CDC gets on TV last night and says that she has a feeling of impending doom. So we have to not consider this pandemic winding down, both from a safety personal issue and then also from a business model. The pandemic, pardon me, the pandemic has thrown our lives upside down, and we have learned how to make our businesses work. And hopefully, you're not laying awake at night as much as you were, because we know it is scary, it's frustrating, it's everything.
Yeah, and it's really interesting. I think that impending doom, you're always waiting for the other shoe to drop. That's what I hear from a lot of agencies and leaders. It's just like, what can we be doing now? So, we discussed, this in numerous conversations, but, Sandy, what would you advise to an agency administrator or ownership or, department heads or that? What is it that we need to be really focusing on now? Or what can we recommend they should focus on now, just to make sure that while they're continuing delivery of services, they found sometimes new and exciting ways. They've incorporated the adjunctive services of telehealth. What is it that they can do to maybe give themselves a little bit of reprieve and sleep better at night?
I think the best thing that any of us can do is to try to be ready. Make
Mm-hmm.
sure that you have your documentation in order. If there's something missing, now's the time to track it down. And please keep in mind that whether you are in the review choice demonstration and you have a MAC medical review people looking at your paperwork, or whether you are looking at a RAC, but there's still human beings who are looking at it, and their purpose in life is not to have you fail. Their purpose in life is not to take money away from you. What they do is to make sure that the Medicare fund is protected and used the way it is supposed to be. So no one expects you to be perfect. No one expects to have your documentation be perfect and every duck in that tight little row. But for the things that you do understand, make sure that is all put together and that you don't have any panic moments when you find out that your documentation is going to go under a second set of eyes. And where Dee was talking about telehealth, that is something new since the pandemic that people are really being able to take advantage of. And especially when we're looking at home health face to face. As I'm sure you're aware, the face-to-face can be performed in a telehealth mode, but it does have to have both audio and video. It can't be just audio like some of the other regular visits can have. And one of the things I'm hearing from Palmetto and other sources is that you want to make sure your documentation doesn't just state that it was video. There needs to be something in that documentation that says, I saw this on the patient, or whatever it is.
Yeah, the thing is, I think we have to go into survey prep mode, and I know that there's combat fatigue through all this with the pandemic, but look at those areas that are going to provide a difference, right, from past years. If you've been in home care for a long time, review those infection controls and have all those waivers in your survey prep binder. Look at telehealth. Look at how you're documenting it, how you're using it as an adjunct service, right? For our patients, we're allowed to use that. We're not reimbursed for the visits, but think about how we're reducing the burn of PPE, and we're reducing the exposure of patients and clinical staff by crossing the threshold for visits. So are we incorporating adjunctive use of telehealth services to check in on our patients, to follow up on things that don't require us to be present in person? And how are we documenting those? Those are going to be something new and different that you need to have a very clear process, and you have to have very clear expectations of clinical staff for documenting. And finally, look at emergency management procedures, right? I mean, I know it seems like a long time ago, right, Sandy? And I've always prepared for natural disasters here in the Southeast, here in Florida, and had an extensive emergency management protocol and process in place for, tracking hurricanes and things like that. But what about, pandemics? And are you following those processes? Are you holding tight? Have they become the new normal for you? And are they well documented? I think those are things that agencies and clinicians can be prepared for, knowing that it's not that eventual other shoe, the other foot is going to drop, and we have impending doom. I would agree with you, Sandy, but just making sure that you're holding tight to those things that are your new normal and that they're consistently demonstrated in your documentation, and having your survey prep binder all pulled together with the processes, the policies and procedures, and the application of the waivers when appropriate, and how that presents itself in your organization. I think that goes a long way to everybody getting a good night's sleep.
Well put, Dee, very well put. As providers, you have all done an excellent job of dealing with the staffing headaches with the people who were ill or who did not feel comfortable being exposed as much as a worker is to the pandemic. So I think what we have been doing is to focus on what fires need to be put out today. How can we take the best care we can of our patients? And we, I think, have swung away a little bit from worrying about the documentation, because there's just so much that can go on your plate without the plate breaking. But it is getting time now that we want to, pardon me, focus again to make sure our documentation is, I am so sorry, to make sure our documentation is going to pass any eyes that look at it.
Sandy, I am feeling so empathetic with that cough. The pollen, you guys, right now, and Sandy's in Arizona, and we're in the South. The pollen right now is deadly. I just want to say thank you to you both. I'm blown away with the amount of information that we got in 2 10-minute podcasts, and I'm wondering if either of you have any closing thoughts you'd like to share.
Well, my closing thought would be, first off, just thank you to everyone who is listening for all that you do. I know that superhero cape gets heavy at times, but you are so appreciated. And do do your very best in the upcoming days, months, weeks, to try to be well-rounded, as I know you can be. Always the patient care comes first, but you have to have your documentation in order to make sure that you get paid for your claims, because if you don't get paid for your claims, you can't take care of people or your staff. So well done, everyone.
Yeah, and my final thought would be sometimes in the middle of the storm, it's really hard to see what you're doing really well and maybe identify where you could, some weaknesses or areas you can do better. So I have always been a big believer in, even if it's a very small sample, is to consider, outsourcing a small audit. Have objective pair of eyes, people that understand what's going on and what are those risky areas in documentation, in eligibility requirements per the COPs, under supervision with infection control, all those kind of things. Maybe really resource and look outside to have a small outside audit and say, yeah, if somebody has no familiarity with our organization, are they seeing what we think we're seeing, what we're doing every day? And it can provide a level of scrutiny that maybe inside eyes don't do. It can provide verification if you are finding things that, yes, they truly are there. And it can also provide you, like Sandy said, that support and that bolstering of you go, right? You're getting it, a good pat on the back for a job well done. And it doesn't take a lot of charts to get that done. So consider an objective outsourced audit from a reputable outside source would be my recommendation, because now is the time to do it, right? Now is the time before you get at the point where all these entities, again, like I said in part one, are chomping at the bit and the gates are open and we've released the hounds.
There we go. And I echo Sandy's statement about thanking all you providers out there that are on those streets, getting your hands dirty and doing all the work to take care of folks as we try and get through this pandemic. And again, thank you, Sandy. Thank you, Dee. So much information. And in the contact information or in the description of this podcast or these podcasts will be contact information for Sandy and Dee if you have any further questions. But until next time, Unfiltered Productions. We're out.